Welcome to today's lecture. The topic of discussion today is chickenpox in children. Chickenpox is a common, highly contagious viral infection which is caused by the virus Varicella zoster. It mostly affects children, especially those who are not vaccinated. It is a simple infection, but sometimes it may be complicated by some serious conditions. So today we are going to discuss the clinical features, pathogenesis, diagnosis, treatment and prevention of chickenpox. I already said it is a highly contagious disease caused by Varicella zoster virus, which is a DNA virus belonging to family herpes virus. Man is the only reservoir for this infection, and all age, sex and race are susceptible to this infection. The source of infection is nasopharyngeal secretion and the skin lesions. Incubation period for chickenpox is 10 to 21 days, with peak being 14 to 16 days. The infectious period is 1 to 2 days prior and 3 to 7 days after the onset of the rash, until rashes have crusted. And remember, once the rash is crusted, this individual is non-infective. All the contacts who never had chickenpox or who are not vaccinated are highly susceptible. 90% of this type of individuals are at a risk of developing chickenpox if they are exposed to a case of chickenpox. The peak incidence is 5 to 9 years age group, and even in the neonate it is higher. And the season when the chickenpox is common is winter and spring season. The tissues which are infected by chickenpox is thymus, spleen, lymph nodes, liver, skin, conjunctiva and lungs. Now let's see the mode of transmission. There is a direct contact which occurs via the fluid of skin lesions, and this is the main mode of transmission. And another indirect contact is via the airborne respiratory secretions, and this is a rarer type of mode of transmission. Pathogenesis. First, the virus enters the respiratory epithelium, and then they replicate in the respiratory tract and enters the bloodstream, leading to viremia, which is subclinical. After that, it invades the reticuloendothelial system, and the virus is again released to the bloodstream when they create a secondary viremia and when the sign symptoms of the disease is seen. Usually they generate the crops or vesicles within 3 to 7 days after the onset of the infection, and these viruses are carried back to the respiratory tract. Then they spread to the susceptible contacts, and if the host immunity is good enough, then they limit the replication of the virus and then they recover. And then they may also remain latent in the sensory ganglia, and then later when the immunity of the individual is low, that time they present as a herpes zoster. The clinical features of chickenpox presents with the prodromal symptoms, which is very minimal and may go unnoticed also. So during this phase, patient has mild fever, malaise, loss of appetite, headache and abdominal pain. This is followed by exanthematous stage, that is the stage of appearance of the rash. Rash appears on the first day of the fever, and the rash is pleomorphic. That means various stages of the rash is seen at the same time, and the rash can be erythematous macules that follows to papules, and there is fluid filled vesicles, clouding and umbilication of the vesicles within 24 to 48 hours, and ultimately crusting of the lesion occurs, and all these different crops are seen at the different stages of the rash can be seen in the same individual at the same time. So this is known as a pleomorphic rash, and these rashes are intensely pruritic. New lesions appear for 1 to 7 days, and the distribution of rash is centripetal. That means it starts from the trunk, back and shoulders, then it spreads to the hands and face or extremities. In this picture you can see the umbilication of the vesicles. All the vesicles, there is a pit like structure. This umbilication is a very characteristic finding in a chickenpox rash. In the oropharynx, vagina, there might be ulcerative lesions, and even in the eyelids and conjunctiva you may get a vesicular lesions. And the lesions, the number of lesions are approximately 300 in number, but it can be as less as 10 or as many as more than 1500. And palms and soles are spared, that means there is no rash in the palms and soles. Hypo and hyperpigmentation may persist for days to weeks after the disappearance of the rash. This picture shows you the pleomorphic rash. Some are vesicles, some are crusted, and then some erythematous papules are just appearing. This picture shows you bullous varicella, and this is one of the complications of the varicella infection. Here the chickenpox rash is infected. So if the condition is like this child requires a antibiotic treatment. Neonatal varicella. This is a condition when mother has chickenpox 1 week before delivery and 1 week after delivery. There is a high chance a newborn may also have a varicella rash or infection. So this condition is known as neonatal varicella. This is a very severe and life-threatening condition. Here the child, baby, needs treatment with varicella zoster immunoglobulin and acyclovir. So this is a newborn having a varicella rash. Hemorrhagic varicella is another rare condition and also a life-threatening condition, considered as one of the complications of chickenpox. Here also you need to treat the child with immunoglobulin as well as acyclovir. Another life-threatening condition is progressive varicella. In this condition, the palates and all the internal organs and viscera may be involved, and this condition is seen more in a immunocompromised child. This also requires treatment with immunoglobulin and acyclovir. This is again another life-threatening condition of chickenpox. Let's see what congenital varicella syndrome is. This is different from the neonatal varicella. This condition occurs if the mother acquires chickenpox infection at 6 to 20 weeks of gestation, and 25% cases of pregnancy can be infected with the varicella zoster. So 6 to 12 weeks of gestation, if the mother had chickenpox, then there is high chance that the baby will be born with the limb developmental anomalies. And if mother acquires chickenpox infection at 6 to 20 weeks of gestation, then baby may be born with eye and brain anomalies. So let's see what are the different features that is seen in congenital varicella syndrome. Number 1, damage to the sensory nerve, which is manifested in the skin. So in the skin you'll get a cicatrix lesion. This is a zigzag scarring lesion which is seen in the skin. This picture is showing the cicatric lesion. Then there might be hyperpigmentation in different parts of the body. Number 2 is damage to the eye, may present with a microphthalmia, cataract, chorioretinitis, optic atrophy. And number 3, there can be damage to the limbs. So there can be severe malformation of the extremities. There might be absent limb, there might be malformation of the digits, or even arms and the forearms. Number 4, damage to the brain may present with a microcephaly, hydrocephalus, calcification, aplasia of brain, absent deep tendon reflexes, Horner's syndrome, anal and urinary sphincter dysfunctions. Now come to treatment. Treatment for varicella zoster virus phytopathy is actually, there is no treatment, only counseling is required, because phytopathy is non-progressive and there is no role of any antiviral drugs or immunoglobulins. But antenatally, if the mother develops varicella infection, then you have to treat her with a immunoglobulin and acyclovir. Now come to diagnosis. Diagnosis of chickenpox is exclusively clinical because the rash is so typical. But if the lab facilities are available, then you can isolate the virus, or you can do the serology for detection of antibodies, and rapid diagnostic test can be done in the skin lesions by direct fluorescence assay, or you can do PCR. In the blood test, you see leukopenia in the first 72 hours, then relative lymphocytosis is noticed. Treatment of chickenpox, you should isolate the patient for 1 week. So don't send the children to their school because they are highly contagious. Then other modalities of treatment is symptomatic and supportive. So relieve the itching, treat the fever with antipyretics, improve personal hygiene, give good hydration and nutrition. And the antiviral drug for chickenpox is acyclovir, but in case of children, this is not given routinely. So role of acyclovir is there if you start treatment within 48 hours of onset of rash. It is believed it reduces the duration of rash and even it decreases the number of lesions. But in case of children, this is not routinely used. There are certain indications where you have to give acyclovir. So those we'll see in the next slide. Indications. Now come to the indications of acyclovir. When to use acyclovir in case of children. If age is more than 12 years. Chickenpox with complications like varicella pneumonia, hepatitis, encephalitis, or if the child has a thrombocytopenia or any other complications like hemorrhagic chickenpox or progressive varicella, and all those you need to treat with acyclovir. And if there is underlying malignancy, other indications are immunocompromised patients. Can be primary immunodeficiency disorders, which are usually the genetic disorders, and secondary immunodeficiency disorders like HIV infection, tuberculosis, or severe malnutrition. And corticosteroid use, here also the child is immunocompromised. So long-term use of steroid, those conditions require acyclovir treatment. And pregnant woman, neonatal chickenpox. Then dose of acyclovir is 20 mg per kg. Maximum you can give is 800 mg. 6 hourly you can give for 5 days. Complications of chickenpox. The cutaneous complications are secondary infections, and this is one of the commonest complication. Here you need to treat the child with antibiotics. Streptococcus and staphylococcus, these are the most common organisms. So you try to cover these organisms. And then another cutaneous complication is purpura fulminans, where it may be associated with DIC, disseminated intravascular coagulation, which is life-threatening and may lead to mortality also. And another cutaneous complication is after the onset of the illness, a week later the child may develop thrombocytopenia. Respiratory complications like varicella pneumonia can occur. Again, staphylococcus and streptococcus pneumoniae is commonest organism, so try to cover these organisms with the antibiotics. The CNS complications are encephalitis, acute cerebellar ataxia, Guillain-Barré syndrome, transverse myelitis, optic neuritis, facial nerve palsy. And acute cerebellar ataxia in case of chickenpox is completely reversible. So within few days this child will recover completely. Some rare complications are there. So those are hemorrhagic, like GI bleeding, hematuria, in the renal nephritis, nephrotic syndrome, and hemolytic uremic syndrome can occur. Varicella hepatitis is another complication. Arthritis, in cardiac myocarditis, pericarditis can occur. Pancreatitis, orchitis are other rare complications. Now few lines regarding herpes zoster infection. This is a reactivation of latent infection of varicella zoster in the sensory ganglia. And this is also equally infective as varicella zoster. But the distribution of rash differs. Distribution of rash is dermatomal distribution along the nerves. So they present with pain and paresthesia, but this pain and paresthesia is less than in adults. In adults, this is more severe, and this condition resolves in 1 to 2 weeks time. Come to prevention. First, isolation of the infected person so that the infection does not spread. Number 2, give vaccines. 3 days after the exposure, you need to give vaccines to the contacts. So more than 12 months to 12 years old children, single dose of vaccine is available. More than 12 years is you need to give 2 doses at 4 weeks apart. Another prevention is by post-exposure prophylaxis. If the child gets exposed to the case, then you need to give immunoglobulin. Varicella zoster immunoglobulin is given intramuscular within 96 hours of exposure. So the household contacts or all the individuals who are exposed, even the doctors who are exposed to the case and who never got chickenpox infection or vaccine, should be getting IVI, varicella zoster immunoglobulin. Infants less than 1 month age, pregnant women, leukemia, those who are getting steroid therapy, all should get varicella zoster immunoglobulin if they come in contact with the case. Okay, thank you. Hope this class was useful for you. Next class we'll discuss another viral infection. Thank you.